fun. So we're going to go through our targeted respiratory assessments, starting from the top, which will include initial assessment. So walking in, I want you, Shanann, you're going to be a COPD patient with chronic, productive cough, shortness of breath today, similar to what we did yesterday. So, hi Shanann, my name is Matthew, I'm paramedic. What's going on today?
Oh, it's just really hard to breathe.
Really hard to breathe. Shannann's probably going to be sitting up, so let's have you sit up. He's probably going to sit up. That's no good. How long has this been going on?
Oh, it's earlier today.
Okay, so as I'm observing Shanann, I can see that he has a full level of consciousness. He's responding appropriately. His airway is obviously clear because he's breathing to me, and I see that he's breathing at an elevated rate, but I see adequate chest rise and fall. He's also a great indication that he has adequate respiratory or tidal volume or minute volume, is that he's alert and conscious and talking to me is another good indication that he's breathing adequately for the time being. I feel a nice strong radial pulse at the wrist. So because he can talk to me, I'm going to go ahead and talk to him. So I'm going to investigate his chief complaint. So you said this has been going on for a few days?
Just actually earlier today got really bad.
Oh, sorry, I missed that. So you got really bad today.
Yeah.
What were you doing when that started?
I was just sitting down having a smoke.
Sitting down having a smoke.
Mm-hmm.
Okay. And how long would you say this shortness of breath has been really severe today? How many minutes?
Maybe 2 hours.
Maybe 2 hours.
Yeah.
Okay. Has it gotten any worse, or has it changed at all?
Yeah,
since?
it's just I can't take it anymore now. It's the same.
Okay. Same.
Yeah.
And is it getting worse when you're up moving around?
Yeah. I can't get up.
Okay. So I know when it started. I know the duration. Have you ever had an experience like this before?
Yeah. No, sometimes I can take my puffers, it gets better, but sometimes I have to go to the hospital.
Okay. So last time this happened, did you go to the hospital?
I did, yeah.
Okay. And what did they do for you when you were at the hospital?
They did some tests and said I had pneumonia and some antibiotics.
Okay. Didn't have to get intubated or anything like that?
No.
Okay. Just in hospital and on some antibiotics?
Yeah, this feels worse.
This feels worse?
Yeah.
But you think it's similar to the last time you had pneumonia?
Same, but worse.
Okay. Anything make it better and worse? Obviously, I'm assuming if you get up and walk around, it's worse with exertion?
Yeah.
Okay. What are you normally able to do?
I can normally walk around the house, get to the washroom.
And now you're, how quickly do you get short of breath now?
I can't, I pee myself.
Oh,
Yeah.
okay. I'm sorry to hear that. So, and do you notice any position that changes shortness of breath? You probably
I don't.
You want to sit up?
Yeah, I'm so happy you set me up. I don't know why I didn't think of that.
Okay. So you feel like, as far as quality, you feel like this is like your pneumonia before.
Yeah.
You have COPD, did you mention that as well?
Yeah.
Okay, so it feels like your COPD acting up when you get a pneumonia.
Yeah.
Okay. As far as, you're not experiencing any pain at all?
No.
No? Okay, and severity, the last time that you had, can you rate this for me?
Yeah, this
If
is
10
the
was
worst it's ever been.
worse?
It's never been this bad.
So if 10 was the worst you've ever had and 0, this is a 10?
This is a 10.
Okay. So, do you have any allergies at all?
Just environmental.
Okay. Any medications?
Yeah, lots of puffers.
Okay, where could we find those?
There's a bag over there.
Okay, so we'll go through those medications. We'll say, and then we'll go through and find out which drugs specifically, but also why they're on them. Do you take all your medications that are prescribed to you?
I do, yeah.
There's nothing that you prescribe that you've discontinued or anything? Any new medications or any changes to the medications prescribed to you? Okay. As far as past medical history, do you have any history of any neurological conditions?
No.
Strokes, seizures, no psychiatric conditions whatsoever? What about heart stuff? Any previous heart attacks, angina?
No.
No?
My blood pressure's a bit high.
Okay, never had chest pain?
No.
Are you on medications for the high blood pressure?
Yeah.
What medication?
Some water pill.
Okay, some water pill. So we'd find that medication there. Your lungs, COPD, how long have you had COPD for?
Oh, for a couple of years ago they told me I had it.
Okay. Have you been noticing that you've been getting short of breath at night or laying down? Anything like that?
Yeah, I don't like lying down.
Don't like lying down?
Yeah.
Okay. How have you been sleeping?
I usually just kind of sleep on the night before.
Okay. What if I laid you down for a little bit? Could you tolerate a little bit?
A little bit, yeah.
Okay.
Yeah, it's uncomfortable. I can't really fall asleep.
Okay. Have you had cough at all?
Yeah.
Okay. What have you been coughing on?
Lately it's been kind of a gross brown, like yellow brown.
A yellow brown?
Like butter.
Okay. Do you normally have a cough and Do you normally
Normally
cough
I
up
cough,
sputum?
yeah.
What color is it?
Usually white.
Normally white?
Yeah.
Okay. But how long have you been coughing up this yellow-brown stuff for?
Just a couple of days.
Okay.
Yeah.
So we've done diagnosed conditions, symptoms, and precipitating factors. As far as his respiratory, he's kind of given us all the precipitating factors. Have you been around around anyone with respiratory, like any coughs or
I've done my own
colds?
for, yeah, a long
Okay.
time now.
Okay. But it's not uncommon for you to have these flare-ups of infection.
It happens, yeah.
It happens. Okay. Any problems with your bowels? Normal bowel movements? Urination normal? Any history of diabetes?
No.
No? Okay. So that past medical history, ask him about, do you have any ongoing medical tests?
No.
Okay. And when was the last time you were well?
I guess a couple of years ago before I had COPD.
Okay, before you had COPD. What about this past week? How have you been feeling this past week?
A little bit run down for about a week, yeah.
For about a week?
Yeah.
And then it has got really severe in the last day, or just in the last 2 hours?
When I really noticed it, yeah.
Okay. Okay. So, Shannon, I'm just going to do a quick physical assessment, if that's okay with you. Okay. So, just going to look at your eyes as you look straight ahead. I'll take a light, shine. Glasses off. Mind my phone. I promise I'm not texting. Okay. So I see his pupils. I'm just going to flip down your eyelid here and see a nice pink. Can you open your mouth for me? So I notice he's got nice moist mucous membranes. His lips are nice and pink, no centralized cyanosis. I'm just going to get you to, I'm going to lean you back just a little tiny bit. I'm going to have a look at your neck veins here. Just turn your head to the side. Okay, so I see no obvious jugular venous distension whatsoever, so I don't need to do any further. If I can turn my light off. There we go. So I turn head back. I'm just going to look and see also, you can look straight ahead now. See if I see any extra accessory muscle use. I stumbled on that yesterday and I was like, okay. Accessory muscle use. I see accessory muscle use. I'm just going to palpate your trachea here and see. Okay, it's midline. Okay. His pulse as far as palpation. Feel nice carotid pulses. Normal rates, normal contour. Look at his chest. I see accessory muscle use, I'm assuming. Do I see symmetrical chest rise and fall? Okay. And do I see an increased AP diameter? Okay, so he's got a barrel chest. So no other rashes, lesions, anything like that. So that's inspection, palpation. Can you just take a nice deep breath for me? Okay. Deep breath. And we probably note a decreased chest excursion because he's air traveling. Did I happen to note whether or not you were pursed-lip breathing at the moment or not? Okay, so we'll just glance and see respiratory, inspiratory to expiratory ratio. What's he look like? So he's got a prolonged expiratory ratio that we'd expect, but I might have a moment and look at that. So now I'm just going to listen to your chest if that's okay. If you can breathe in and out through your mouth, that would be awesome. Deep breath for me. Sorry. Do as I say, not as I do. Compare side to side. Sorry. So auscultation sounds fine. He doesn't have enlarged enlarged neck veins, but I will listen to his heart sound for a quick. Just breathe easy. And I'd do the same with my bell if I had a bell. So, auscultation, I could have him sit up here for me. You've had a productive cough, haven't you? So I'm just going to get you to say the words 99 for me, okay?
99, 99, 99, 99, 99.
Okay. So we'd probably find an area that we could investigate a little bit further. Any pain in your abdomen at all? Okay, I'm just going to push just gently here. No pain, doesn't cause you any discomfort. I don't feel anything enlarged up in his, feeling enlarged. No incontinence. We'll come down to his feet. So see any pedal edema?
Sure.
Just pedal edema. Okay. Put plus 1, 2, or 3.
Sure.
How pitting? Can I draw a smiley face?
Why not?
Why not? Okay, so he's got a little bit of pedal edema. Is that edema new for you?
No.
No, you always have swelling? And you're on that water pill?
Yeah.
And that hasn't changed in the last week at all?
No.
Okay. So we're through a physical assessment, now we can turn our attention to differential diagnosis, which will provide me the opportunity to see, did I forget anything in my physical assessment? We're just gonna stop there. Just a second. Good stuff.